let's talk about this stuff. So we have a question from Deanna. You can email us questions. We love those. Email them to questions@askjoedimatteo.com. Deanna said, I was diagnosed over 20 years ago with
Sjogren's.
Sjogren's. Is there a supplement I could benefit by taking that would help with the symptoms?
Yeah. So just looking at a quick definition from the American College of Rheumatology, they described it as a systemic autoimmune rheumatic disease that affects the entire body. And then it manifests as inflammation of the salivary and lacrimal, or the eyes, those glands, most notably, and can lead to some of the following hallmark symptoms that we'll look at.
Okay, so you said rheumatic, so that means inflammatory, right? Inflammation. And it's systemic, so it's throughout the entire body, but it's specifically affecting salivary glands and eyes?
Yes, those are two of the main areas that we'll see various symptoms occur.
Okay.
But it has the potential to, manifest in musculoskeletal pain, joint pain, stiffness, brain fog, vaginal dryness. There's a whole host of things, nasal dryness, but the top two symptoms that often guide diagnosis would be dry eyes and dry mouth.
Okay.
So you got to kind of mention those at the top. And as far as what we recommend to her, we'll just assume that she's dealing with those top couple for sure.
If she's been dealing with this for 20 years, it's probably safe to assume that she's seen her doctor about it many times, and it's probably, are there medications? Are there, she's looking for supplements, but
yeah. So the one thing I wanted to add to that is, from a diagnostic perspective, you could see somebody that has primary Sjogren's syndrome. So the cause is maybe a bit unclear. So that's the primary thing that's occurring. Secondary Sjogren's could be as a result of different underlying disorders that the individual might have, or maybe a medication contributing. But even looking at secondary Sjogren's, that's the link that we'll see with other notable autoimmune conditions like rheumatoid arthritis, lupus, and autoimmune thyroid disease. That's typically where we see it, and there's definitely a link there.
Secondary meaning it's not the reason, it is a consequence of some other greater issue, like lupus or rheumatoid arthritis.
Yeah.
They
say up to like 50% of cases, often are associated with an underlying, autoimmune disease.
Yeah, I see 14 to 18% of people with lupus also have Sjogren's.
Oh, wow.
Because again, just kind of in the broadest way, the mechanism of how you get Sjogren's. We don't know why when there's an autoimmune disease and basically your body is self-attacking, why does it manifest as multiple sclerosis in somebody, or lupus in somebody, or Sjogren's? That part we don't know, but the biomarkers are often very similar, and that's again the core thing is that it's the body attacking.
Okay.
So it makes sense mechanistically why somebody would have lupus or RA, rheumatoid arthritis, and then have Sjogren's, secondarily. Or, some people, maybe it's milder for whatever reason, the body is attacking just, I don't want to say just, because it can be very uncomfortable to say the least, even in its, most basic, tear duct and saliva form, can be very uncomfortable, but at its most basic, we don't know why, that would occur.
But again, so you're just making sure I'm understanding these correctly, because this is something I've never heard of. It's a syndrome, and syndromes are collections of symptoms, but not necessarily a cause. So when we say it's Sjogren's syndrome, we're saying it's just this specific collection of symptoms, but it could be from some other. Got it. Okay. All right. Cool. So what are the standard treatments? She's presumably already seen her doctor. What has she likely gone through or is dealing with?
Most likely would be a DMARD, disease modifying anti-rheumatic drug.
Okay.
And they basically are modifying the immune system. They're used for any of the conditions we named above, RA, MS, etc., like hydroxychloroquine or methotrexate.
Okay.
So, if you've got more of the, again, I hate to use the word mild, but if you're not dealing with severe fatigue and joint pain, potentially with some saliva substitutes and some, refreshed tears, things like that, you can get by without having to take such a heavy hitting drug. But if it's debilitating, in the sense of you're dealing with a lot of those secondary symptoms, maybe we'll call them, then you become more of a candidate to end up wanting to go on a drug like that. But it's you got to live and you got to be able to deal with this. So, nothing wrong with doing those drugs, but if you can get by without them, again, if you can do some of those other interventions, maybe a couple supplements we'll go into later can at least be of assistance, not maybe a, night or day change. That's basically what you'd be looking at. Yeah. Hydroxychloroquine, methotrexate.
For sure. The big thing is there's no matter which medication, over the counter supplement that you end up taking, there's no curative treatment.
Right.
So even if you're on one of the DMARDs or hydroxychloroquine or some prednisone, they're not going to cure the underlying, but they help to manage the symptoms that are occurring. And so the key, the name of the game with Sjogren's is managing the symptoms as best as possible, and not to just manage them for the sake of managing them, but because if you're not treating the dry eye, if you're not treating the dry mouth and those sorts of things, that's when you can see, corneal damage, optic neuritis, things that are more serious. And so if you can keep those at bay, it's important to find whatever works for you. And often it takes a multi-pronged approach. And even looking at the oral implications of Sjogren's, you're thinking to yourself, well, dry mouth, it's got to be pretty unpleasant, but
drink some water. What's the big deal?
What's the worst that's going to happen? You're way more prone to, different mouth infections in large salivary glands, gingivitis, tooth decay. And so there's even prescription toothpaste that will be utilized for pretty much anybody that has these symptoms. It's just the benefits greatly outweigh the risks in that case.
Wow.
So it's super, super important to manage the symptoms.
It's almost like your body is designed to do all these things together. And when you take a piece out, all of a sudden you have issues.
Yeah, body produces a lot of saliva.
Wow.
And if you've got something that's shutting that down to a large extent, that's a good point of the oral issues that you can have for sure.
Definitely.
Okay, so you talked about the medications she's probably dealing with. And she said, I love that you were pointing out the symptoms. She said, is there a supplement I could benefit by taking that would help with the symptoms? So it seems like she knows this is, I guess at 20 years in, she knows this is not going away. Are there any supplements? Is this something that can be supplemented to aid?
Like I kind of alluded to, there are some things you can do. Omega-3s, that's going to help with inflammation as well. So especially if you're having some of the joint pain and things like that, but there's some data about omega-3s, like 800 to 1600 milligrams twice a day. Vitamin E, 400 units a day. Just be careful if you're on any, blood thinning medication, because if you take both of those supplements, they can have a little bit of an antiplatelet effect. So if you're, because this does often affect, because one thing kind of forgot to mention here, there's a genetic link to it, but also estrogen deficiency. You see it a little more in women. So estrogen deficiency has, maybe a contributing factor. So a lot of times here you are dealing with either severity or onset a little bit later in life, especially for a woman. So I do want to bring up the medications, because that could certainly be something that you're on as well as you're, potentially aging and dealing with that. So just watch if you take both of those supplements, if you have it, and, Eliquis, Xarelto, just watch those. Also NAC, 600 milligrams twice a day, and vitamin D. Something we're actually going to be talking about here a little more in depth, but something that personally I would recommend with any autoimmune condition. Again, not as a panacea, cure all by any means, but just as something that has shown to have immunomodulatory effects, that we would recommend you take that, get a level, and then dose according to level. That's in a way, and again, the level's not a perfect measure, but it's the best we have. And with a lot of supplements and nutrients, we don't have any real measure of it. At least go with what you can and get a level and have a better idea of what your need may be.
I want to just add one thing to what Joey said as well, specifically with the omega-3s. And so in addition to the anti-inflammatory effect, the evidence is mixed, but it seems that it might have a beneficial effect on dry eye symptoms specifically. So in addition to the, the underlying that's maybe occurring, it's not a bad thing to consider either, adding some extra salmon to your diet or supplementing with some extra omega-3s.
Yeah, that's a great point.
Especially if you are noticing more of the dry eye issues. And then there was, as far as like a lifestyle perspective, not necessarily a treatment.
Yeah.
Those with Sjogren's, they're a little more likely to end up with specific lymphomas. The specific one is B-cell non-Hodgkin lymphoma. And it seems as though it is fairly treatable if one is diagnosed. It's just important to, keep an eye on swollen glands around the neck and the face. And so all of this, in addition to managing your symptoms, monitoring and keeping up with your eye appointments and your dental appointments and checking for swollen glands, not to be over the top, but just to, again, view this whole thing holistically. It's just as important as, making sure you're hitting the right over-the-counters and supplements and such.
Definitely. And we're always want you
sense.
to advocate for your own health. And I think that's a huge point but especially maybe if you have one of the, again, we use the word milder for lack of a better term, and you say, hey, I'm kind of getting by with basic, again, we'll just simplify it as refreshed tears and saliva substitute. Be aware over time, if you've had this for 10, 20 years, that you do want to get checked for those kind of things and be aware of the risk that you are at, regardless of severity, for something like lymphoma, because there's a clear link that you have it. Lymph node swelling is, the most simple thing you can do to check, but obviously getting checked by your doctor.
Yeah. Knowing your own risks seems like a really good idea, no matter what
that's a great point. Yes.
And this one might come as a surprise, but because there are such strong fatigue-related symptoms that can be associated with this. The Sjogren's Foundation, who has come up with like a pretty extensive set of guidelines, and for the fatigue symptoms specifically, they recommend exercise. So I know that, that's definitely shocking that I threw that in there, but that is a massive lifestyle treatment or intervention that's will often be recommended.
Okay,
so keep it moving.
So very cool. So Deanna. Exercise if you're not doing that. And then that was a whole bunch of supplements that Joey suggested. That's very cool.